Hello, people. It's election season, folks. One of the things you're going to hear a lot of opinions about is universal health care, or as I like to call it, heartland health care. You're going to hear a number of reasons why it's a bad idea. The debate at first can actually seem kind of overwhelming. There's so many numbers and statistics and reasons for it and against it. But the truth is, the people who are opposed to health care really don't have any good reasons. Don't believe me? Just watch. Right out the gates, what do they start with?
We have to let the free market decide.
It occurs to me that, we have let the free market decide. It's already decided. The free market has decided to saddle us with the most expensive healthcare system on the planet. That's right. Total spending in 2007, $2.3 trillion. That's $7,600 per person. Per person. The free market's given us a healthcare system that costs 16%. 16% of our GDP. The free market's also given us a healthcare system that increases at 2 times the rate of inflation. And here's what you say.
Maybe. But I prefer the freedom to choose.
To choose what exactly? No care? Or bad care? Seems to me we can make this a whole lot more interesting. Maybe you could choose between no care and care. Good care. Quality care. Care that isn't more expensive than your mortgage payment. What do you say to that?
I don't want some bureaucrat dictating to me what medical procedures I can and can't have performed.
There's just one problem there. We already have that. Our healthcare system is riddled with inefficiency, excessive red tape, forms, paperwork, folders, files, denial of service, rampant waste excuses, inflated prices, patient neglect, and outright fraud.
I don't know. My cousin lives in Canada, and he had to wait 6 months just to have his tonsils out.
Really? Bullshit. What's his name? What's his phone number? I want to talk to him. Where's he live? What's his address? You're full of shit. This is one of the most common talking points you hear out of these people. They know somebody. They have a friend or a family member who lives in Canada who, had to wait 6 months to have their tonsils out or a tumor removed. I find it kind of too convenient that everybody in opposition to healthcare has a friend or family member who happens to live in France or Canada who's had to wait 6 months for one of these procedures. Besides, it seems to me that even assuming this is true, even assuming that there's all these people waiting for 6 months, according to your own logic, they should just be able to go save up a bunch of money, be self-reliant, and go use the private industry. That's right. They have a private industry. They have a private industry in Great Britain. They have a private industry in Austria. They have a private industry in Canada, in Germany, in France, in Australia. They have a private industry in all of these countries, in every single first world country, which has a universal health care plan, unlike us. They also have a private industry, for people who just have more money than they know what to do with. People like Jennifer Lopez, who wants to spend, who wants to insure her ass for like $1 billion or whatever it is. And I say, you know what? Go for it. Let them do that. I tell you what, why don't your cousin just come across the border and get service over here? He could, doctors will see him. I mean, what, he couldn't afford it? That damn right he can't afford it because it's expensive as shit. He's got to wait 6 months to have his tonsils out, or 9 months to have a tumor removed. There's only one problem. See, the thing is, if it's universal health care, and once again, this is assuming that you're telling the truth, which you're not. You're lying. They had to wait to get the service. It's not like down here where you wait to not get it. You spend a boatload more money, wait sometimes even longer, and you don't even get the service. Or, you either go without or you go in debt for the rest of your life. Something else to consider here is that we're the United States of America. We aren't Canada. That's right. We don't have to copy Canada. We could copy somebody else, like, say, the French, where, you get at-home sick visits. Fuck the French. We could be independent, American independence. And we could put some of that good red, white, and blue American ingenuity to work. The same shit that sent us to the moon. We could do that to fix our healthcare system. We could come up with the best, most efficient healthcare system in the world, ever.
Yeah, but you know and I know that universal health care is just another way for some politician fat cat to get rich.
Versus what? Some corporate fat cat getting rich? We've already got that. In addition to the political fat cats getting rich.
You know, what you're talking about is socialism.
Well, you make a good point. We certainly wouldn't want any of that socialism here in the good United States of America. Wait a minute. I think we already have it. Wait a minute, we do! It's called Medicaid and Medicare! That's right! We already have socialism right here at home! It's already here! And guess what? It works! There's a reason that you don't see politicians running on the platform to abolish those things. You know why? Because people like it. Because it works. It's efficient. It's better than not having it. It's the same reason you don't see any of these other democratic first world countries abolishing their national health care systems. Because people like it. That's right. If you ran on that platform as a politician in one of these countries, you would lose. Besides, we really don't need to be nitpicky about names here. You can call it socialism. I don't care if you call it dog shit. Alright? If it works, it works. And every other first world country on the planet that has universal health care, oh wait, that's all of them except for us, their systems work.
America's #1.
More like 24th in terms of life expectancy. Can you even name 24 countries? Oh, that's right, I forgot. You were talking about #1 in terms of cost. So that's it. Those are the arguments they're going to use. That's it. That's them. That's all of them. They will always, even any variety of them, they all come back to that. And you can take any one of those comments and shove it right back up their rear ends. Till next time, this is Aaron. Thanks for listening.